And when we think about autism, the whole brain is really impacted, right? So if we think about social processes, like core social disability, that's affecting the underside of the temporal lobe area of the brain. We've got the language areas affected because of the symptoms that we see in social communication and language development. And I'll talk about as well, but movement is also an indicator of autism. And so we see the movement areas of the brain affected as well. And so when we look at a chart like this, initially things are looking okay, right? Those reflexes tend to be intact, but then they're not being reinforced in the same way to lead to the same types of social development as we'd expect if you don't go on to have an autism spectrum disorder. And so over the course of the first 2 years of life, we really start to see that divergence in social behaviors over time. And so again, just to come back to the diagnosis, but social disturbance is the core and defining symptom in autism. So I talked about the fact that we expect the social behaviors to be distinctive and greater than expected given their mental age, that's the MA. And again, we talk about some skills emerging over time, and we might see changes given that over time, given the expectations across childhood. Okay, so just to remind there. But what does that all mean, right? How do we put that together? And so we know that accurately diagnosing autism is very challenging. There's no biological test. So unlike some other disorders where we can take a blood test and say, yep, you have, I don't know, something, do a strep test, right? And we can see that you have strep throat. Do a mammogram, you can see about possible breast cancer. There's no biological test like that right now that's exists for autism. There's a lot of things coming out, and I'm going to talk at length about one of them that I'm involved in. But we keep following the literature, and there's some things that are okay out there, but nothing that's been as good as something like the strep test, which diagnoses strep with over 99% accuracy. In terms of other challenges is that there's the phrase, if you've seen one child with autism, you've seen one child with autism. There's huge variability in the behaviors across every child and individual that has autism. And then there's even variability in behaviors with the same child, right? How does a child perform in one setting versus another? How do they perform when they're 2, when they're 4, when they're 6, when they're 8, et cetera? And then we see a lot of symptom overlap between autism and other developmental disorders, which I'll go through in a little bit. Was there a question that I'm starting to see something pop up, Kevin? Did you want me to answer one now?
This person just asked, did you say the social orientation reflexes are or are not there in ASD infants?
Awesome. Thanks for that. And yes, thank you for actually clarifying if I've said it fast. But the social orientation reflexes tend to be there in autism. So we're seeing that reflexes are okay, intact. We've done some research that shows that they might not be coming offline at the same rate. So we know, for example, that startle reflex, the Morrow reflex that babies have, that starts and then goes away over time. We see some lags in some of these reflexes disappearing at the same rate, but they're all there. They all seem to be intact initially. So there's some differences in coming offline and then how they translate to the more volitional behaviors. Thanks for the question. Is there any others, or should I keep going, Kevin?
Yeah, go ahead and keep going. At the moment, there's nothing else, but thanks for doing that.
Awesome. Thank you. And so when we think about that variability in autism, there's, again, those of you working with autism, there could be huge amounts of variability. So some of it's in the levels of cognitive functioning. And so we see the full range of kind of cognitive abilities in autistic individuals from pretty high levels of cognitive impairment all the way up to genius levels of IQ. In our individuals that have lower levels of cognitive functioning, we tend to have a higher rate of seizures and diagnoses of epilepsy. We also might see what's a lot more medical comorbidities. And some of those could be things like gastro issues. We might see, again, those seizures. We might see, um, yeah, just a kind of a range, sleep disorders, feeding disorders, et cetera. In individuals that are quote unquote what people think about as higher functioning, which is a term that has a lot of connotation to it today, we tend to see more psychiatric comorbidities. So things like anxiety, depression, and things like that. And so when we put the kind of diagnostic symptomatology together for autism, and I'm going to show a lot of examples of this coming up, but we have that social impairment, communication impairment, restricted interest. And I know this is a bit older school because the DSM-5 doesn't separate social and communication. But for sake of this, we have autism as the overlap of kind of all those. We used to have a diagnosis called Asperger's syndrome, which we no longer make, but I think a lot of us, particularly working with individuals, feel like we know an individual would meet criteria for Asperger's syndrome. But then we have things that are kind of falling on those fringes, right? So for individuals that might have a social impairment, but maybe it's not their core, maybe it's more of an anxiety disorder. We see social phobia. And we see also kind of a lot of social impairments, obviously, in individuals with schizoid or schizotypical personality disorders or diagnoses. In terms of restricted interest, we might see things like OCD, and there's a lot of overlap, and some of this can be really challenging to tease apart. And so here's another graph showing something similar, right? When we have ASD as the bubble, we can see a lot of symptoms, and some people with intellectual disability, for example, will have autism and some do not. There's individuals with autism that obviously have a lot of language difficulties, but there's a lot of people with language disorders that don't have autism. Same with learning disability. ADHD, probably bubbles should get a lot bigger these days. But ADHD is a common co-occurring condition, but obviously individuals with ADHD also don't have autism. And so there's all this kind of overlap and symptomatology that can be difficult to tease apart. And when do we say that a symptom of ADHD is secondary to their autism versus when you have ADHD and not autism?